It's my honor every year to introduce a friend and a very important member of the governor's cabinet, David Brinkley. And David has started his career, grew up in Frederick and still lives there. He's a fellow Episcopalian. He was in the financial planning business, but for the past 25 years, his focus has been in public service. He was elected to the Maryland House of Delegates in 1994 and gained some leadership there. And then in 2003, he became a state senator. And during his years in the state Senate, he served a couple times as the majority leader. And so he has a lot of legislative experience about all the things we're talking about today. But when Governor Hogan was elected, he named David Brinkley as his Secretary of Budget and Management. This is probably the most complex of all of the state agencies, or at least I would think it would be. You can think about how it's been this year, for instance, trying to estimate how much the revenues might go down from restaurants, sales taxes and so forth, and how to incorporate the money that comes in from the federal relief programs and how to distribute those to to the local governments and education and so forth. So this year has been particularly chaotic for someone trying to monitor and estimate and plan for a future budget. The budget is the most important policy statement that any legislature passes. It's the one bill they have to pass. They can't go home till they have passed a balanced budget. And so it is really a very, very complex process from start to finish. And so it is now time that David Brinkley will share with us how the governor's budget is, what it's facing this year, and to a certain extent, how it responds to the various issues that we've been talking about this morning in terms of health and energy and so forth. So, David, you're on. Thank you.
Thank you. Thank you, Ardith. This is, it's quite an honor, and I appreciate the opportunity to be in front of you again this year. This technology and the changes we've all had to deal with are absolutely staggering. I have in front of me, certainly the iPad that I'm connected to you, and I can see the video there, and then I have the earpieces connected to. That's the old iPad. The new one has my prepared statement here. And then I have the phone next to me, and there have been times I've been on 3 different meetings with all these different devices. And here I'm sitting in the basement of my home. Who would have ever thought that we would be in these type of circumstances? But at the same time, it also points to some of the blessings that we have for being around in this time of mankind. The technologies, not just to communicate, but also when you think about the fact that this pandemic reared its head. We had our first, I think our first fatalities in Maryland a year ago tomorrow. And we already have close to, I think maybe in the next couple of days, we will surpass 1 million arms in Maryland that will have been immunized. I was just on a call, an interagency call at 11 o'clock, and that factoid is out there. So think about what that was: smallpox, polio, all those other ones, the decades in some instances it took to develop a vaccine, and where we are today with this. Yet we all focus on what's not working, or at least if you pay attention to what's going on out there in the with the press and everything else. So I try to remind my team exactly where we are and how blessed we are to be in this environment. Not to say there aren't challenges, and it certainly isn't to say that there isn't some pain out there. But when we look at where we had been and where we could be, and none of that I just said is even in these prepared remarks. So I appreciate the opportunity to be here. So I am going to talk a little bit about the budget. And I guess the other key word that I keep saying to people or try to impress upon people is the word volatility. There has been a science and an art to trying to figure out what revenues would be and what our responsibilities would be. And this whole year has thrown all of that out the window. I likened, I tried to make the comparison with somebody today in a phone call that it's not unlike how medicine used to be a century or so ago. And someone came back and said, "You mean we don't do bloodletting anymore? You just have to wash your hands and there will be an exponential increase." And that seems to be where we're headed this year with budgeting. So let me get to my remarks. I'll be happy to take some questions. And I appreciate the opportunity to be here. And Artis, thank you very much for that very kind introduction. And I've known the governor for over 20 years, and I told him, I said, this is the one area where I think I can help you out. Otherwise, I'm prepared to go back and open my practice up and take care of my clients. So unfortunately, this year, like so many other things, meetings in person are just not possible because of this pandemic that we're facing. So hence we're here by technology. 2020 was a year we will never forget and will forever define who we are. You can look at that as a curse or you can take that as a blessing. Because the way I see it, it's not what happens to you, it's what you do about it. And that's what I keep trying to remind the staff in the governor's office. It's what I keep trying to remind the other cabinet secretaries. This coronavirus has completely disrupted our lives. It has kept us from gathering with friends, family, and fellow parishioners. It has caused loneliness for those living alone and have been quarantined out of fear for exposure. For those who did test positive, it was the ultimate game of chance. Some barely knew that they have a cold, while nearly 7,800 of our fellow Marylanders have lost their lives to this terrible, terrible virus. And as I say, tomorrow, Maryland will commemorate the first COVID-19 cases, and Governor Hogan has declared tomorrow a day of remembrance for those who have died. This pandemic has been devastating in so many different ways. It's hard to believe that it could have been so much worse, especially when you look back and use 1918 as a comparison. A lot of people call it, the Spanish flu, 1918. It was called the Spanish flu, for those of you who don't know, only because the other Western democracies and the German Empire, since we were at war, they wouldn't admit that there was a severe virus failing their soldiers. Yet the Spanish press was the only one who talked about it. Hence, it became known as the Spanish flu, because everyone thought that, well, it's really bad in Spain. They didn't realize it was really bad everywhere else. In Maryland, I'm proud to say that all of us did step up to the plate and really did our part to slow the spread. Our governor and other elected officials followed the science rather than the political outcome. Partisan bickering, for the most part, certainly was pushed to the sidelines. I will acknowledge that with the speaker and the president and how the governor worked together along those lines. We broke down barriers that would have prevented a rapid response to this deadly and unknown virus. Our healthcare workers worked around the clock to support those in need. In fact, many of them worked to the point of dropping over themselves. And excuse me, we grew our hospital capacity for those who needed round-the-clock care. I'm going again off my remarks here to point out something that I'm very proud of. A lot of people don't know that Maryland stood up 4 hospitals within a matter of weeks. And the professionals said it might take you 18 months to get those up. We transformed the Baltimore Convention Center and the Hilton to a hospital. DPSCS, that's the Department of Corrections, basically created a hospital on campus in Hagerstown to handle the care there. And though this has not gotten a lot of attention, comparing Secretary Green's actions in dealing with the prison population to other states has been exemplary in this state. He was very aggressive in getting ahead of any type of symptoms. We instigated response pay and quarantine pay so that guards showed up and people didn't call in. And I got to tell you, I'm very proud of what they've done and what they've been able to do, and the very, very aggressive monitoring. You heard something in the news reports the other day about the Chesapeake Center in Baltimore City. And that's basically a facility that we run for the federal government, and we have to cough out money out of our pockets because they're not paying their fair share. And the other hospitals were ones that we recently shut down in Tacoma Park. We had closed one, I think with the Adventist system, shut it down. They moved to a new campus. We reinstituted the old facility to handle non-COVID cases so that the new hospital could handle COVID cases. And then the Laurel Health Center was reactivated to be able again to handle the caseload that was directed to them. And none of this has been talked about as to what happened. And we saw some news reports going on out west when they did open up some emergent care facility. We had all that functioning within 6 weeks. And in fact, we were even having conversation of, well, where's this load of patients that we were told were going to be coming down the pike? And sure enough, it hit over the winter. So let me get back to my statement here. My staff would really, I don't know, maybe they'd be happy if I wandered this far. But Marylanders did what they did and what they had to do to protect themselves, their loved ones, fellow workers, and our neighbors. Social distancing, wearing masks, washing our hands more frequently, staying at home, and keeping travel to a minimum, if at all. We even saw the impact of that by reduced flu occurrences. We didn't have that widespread, which we normally see in the news a lot. Certainly this took precedence, but when you do the actions to prevent against COVID, by definition, flu occurrences also dropped off the face of the earth. So from my perspective as the budget secretary, state government directed over $11 billion in aid to support our fellow Marylanders suffering as a result of this horrible pandemic. This money was spent on rental assistance so people could stay in their homes, increased unemployment aid, grants to small businesses affected by the virus. And one nomenclature that I like to use is a lot of people call them small business, medium business, large businesses. They are small employers, medium employers, large employers. A family depends on what they can do at that facility, that employment, and they use that to help take care of their family and their community. And certainly healthcare supplies. The pandemic has put a lot of pressure on the state budget. The slowdown in the economy meant a decline in anticipated revenue, while at the same time, we expected our expenses to go up dramatically, and they did. Early reports from our revenue consultants, Moody's Analytics, our state was facing a $4 billion shortfall. In a $20 billion budget, $4 billion is massive. Fortunately, those predictions did not become reality. Instead, in fact, the exact opposite occurred. Revenue continued to come in. Marylanders were adapting to the new public health protocols, and more importantly, so did the economy. State employees in a matter of months went from, now this is just the state workforce, we went from less than 1% to nearly half of the state workforce was able to work from home through technology, and agencies were seeing significant cost savings in things like healthcare, office expenses, and more importantly, travel expenses. These savings, combined with an influx of federal stimulus dollars, meant this year's budget wasn't starting off nearly as bad as we thought it would. And this is not unique to our state. Other states saw something similar, but Maryland weathered the storm better than a lot of other states. It didn't mean we're in the clear. As of the latest projections, revenue is still $900 million less than it was projected to be 2 years ago. But our next revision will be released in 6 days. Unemployment remains high, and businesses and individuals still struggle with the ongoing effects of the pandemic. We received, I'm going off memory here, so it's not written down in front of me. By the time you count in the direct aid the state received, direct aid education institutions received, direct aid the universities received, direct aid through unemployment benefits and PPP programs to employers and things like that, Maryland received about $30 billion into the economy. from the federal program just passed back in May. That we never saw the impacts of that coming, and that's what's kept us afloat. Whoops. This thing went back to the beginning. Let's scroll down to where I was and get caught up here. Like I said, technology, it just doesn't help us at all. That's not true. It does help, but it doesn't help when you have operator error like me trying to do this. Okay, here's where we were. So I did the projections and where we are. So despite all of this, we were able to construct a budget that's fiscally responsible. It reserves monies to cover any additional COVID-related expenditures such as PPEs, quarantine pay, and other pandemic expenses not covered by federal funds. And the budget that we submitted provides relief to Marylanders in need. There was $1 billion in direct stimulus and tax relief. There was enhanced temporary cash assistance benefits paid out of $100 per month for 6 months for those families that are particularly needy. And most importantly, we did this without raising taxes, because whether you buy some of the hype or not, Maryland's tax structure is still very, it's not as it's progressive on the income tax side, but when you look at sales taxes and everything else, it's very regressive. So within this framework, we continue our unprecedented investments in education by fully funding all of K-12 mandates, including the governor included another $213 million in what we call hold harmless spending. All of the state education formulas are based on attendance as of June 30th, or check that, September 30th. A lot of people don't know that, but the enrollment data for that one day, that's the snapshot that we take, has to be compiled. It takes about 60 or 90 days to compile it. By the time we audit it, we're 120 days down the road, and that's when we have to have the budget submitted. So we use that as the snapshot as we create all the funding formulas. Well, so many children were kept home or weren't able to be properly counted that we had a decrease in enrollments, official enrollments, by about 4%. Depends where you talk, but overall about 4%. Well, that meant that we could have reduced education funding in some type of comparable fashion. There are other factors that go into the formula, but basically the way the law was written, we didn't have to put in another $213 million. The governor said, do it. Because when kids come back to school and the education organizations have so many other things that nobody ever saw coming to deal with, let's not let this be one of the factors that causes an interruption. And it could very well be that on September 30th of this year, perhaps those students will be back. Maybe they won't be back. We don't know. But right now, the operative word is volatility. There's going to be just lots of changes. So we're trying to take this factor off the table. We provided healthcare coverage in this budget to roughly 25% of all Marylanders. That's 1.5 million people. We had been at about 20%. The numbers are up. We've got the money in there to take care of that. We're ensuring 21,000 children can receive child care scholarships, 341,000 households with SNAP benefits, and 255,000 households with energy assistance. The SNAP benefits is basically food that they can go to the store and buy some food along those lines. And we're also, this is outside the document, but we're also providing vast resources, or basically whatever the food banks are saying we need so that we can either refrigerate food, buy food, or do whatever we have to do. We've been moving those monies along too. And we continue record funding under the Justice Reinvestment Act to try to continue efforts to reduce crime. Everybody needs to feel safe, not just from the virus, but also in their homes. If there's one thing we've learned over this past year, it is the importance of small businesses, as I said, employers on our economy and keeping people working. So the governor proposed, and I give them credit, the legislature quickly passed an emergency legislative package to provide more than $1 billion in direct stimulus and tax relief for Maryland working families, the small businesses, and those who have lost their jobs. We support 55,000 Maryland businesses by providing sales tax credits of up to $9,000 for 3 months. This was a recommendation that I gave to the governor that he adopted. He adopted it for 4 months. The legislature pared it back. It came from the fact that at the last revenue projection meeting in December, the comptroller's office gave us this factoid, and it blew me away, and I'm just going to share it with you. The comptroller collects all sales taxes that we do, and they collect them on a monthly basis. Anybody who sells a product and collects the sales tax, they're required to send it in. So every retailer has a sales tax account in Maryland. And the facts are that the top 63 or 60 sales tax accounts, and while they cannot name them, they know who they are, but they can't publicly name them. I'll go out on a limb, and I think it's safe to say they're the Amazons, the Etsy's, the Walmarts, the Home Depot, the Lowe's, anybody that you or I could go, Wayfair, where you would go online and buy things. The top 63 accounts increased their contributions in their sales tax payments to the state of Maryland by about 30 to 35%, depending on the vendor. 30 to 35%. The bottom 60,000 accounts, the top 60 accounts, the bottom 60,000 accounts had a decrease of 25% of the monies they sent in. So the mail order economy thrived. And in fact, we saw that with the delay in package deliveries all through Christmas, that they were just overburdened by the volume of what was happening. And yet our Main Street mom and pop stores saw a tremendous decrease. The restaurants, and some of them were hammered and shut down. So we saw that vast disparity. This idea came about because my thinking behind it is I recalled sitting on the budget committee that the state does allow a retailer to keep a small commission when they collect sales tax. So if they collect 6% from me when I go in and buy something, they might remit to the state 5.95% of that, and that other 0.5% goes in their pocket for handling the aspect of that. What we attempt to do here is to say you collect the 6%, you keep the 6% in your pocket, the businessman's pocket, as long as your sales volume was below $1 million. And so we were trying to help the small mom and pop and the restaurant businesses that way. It's not a lot, it's something, but we're trying to do something to create an immediate benefit for them as they're dealing with the crisis today and in the wintertime. So we also, in that bill, safeguarded Maryland businesses against some tax increases triggered by any state loan or grant. The federal government made the rectification of this issue when they passed the most recent tax law that a business who received a loan or a grant would not have to declare that as taxable income. However, technically under the Maryland law, they would have to declare that as taxable income and pay tax on it. This bill allows that to be tax-free brought in. We also provided rebates to more than 400,000 recipients of the Earned Income Tax Credit, $500 for families and $300 for individuals who claim the credit in tax year 2019. It will be $250 for families and $150 for those who claim it in 2020. And these are the so-called working poor. And this is refundable. They might not have, meaning they might not have paid all that much in taxes, but they will get this back in a tax credit that comes back to them, and hopefully even a check. In fact, I'm told that those checks did go out within a week of that bill being passed and signed into law as an emergency measure. So in wrapping up, let me just tell you, we know in unsettling times and for the foreseeable future, public health will continue to play a direct role in the success of our economy. While it seems like our economy may be in the clear in the short run, we all have to come to grips with the fact that our long-term prospects are just frankly unknown. As a result, it's imperative that the state maintains its fiscal discipline by using federal dollars whenever and wherever possible to help Marylanders with one-time spending, not long-term programs. Maintaining our cash reserves for a time when federal dollars aren't going to be there to help. Lots of money is coming down the pike. And as I've had conversations with the president of the Senate, the speaker of the House, and the chairman of the budget committees, our challenge right now isn't short term. We've made sure that resources have gone out the door so that people get the cleaning materials, the equipment, the pay, or whatever they need to do their jobs. It's going to be when the hangover comes next year and the federal dollars dry up, that then what are we going to be doing and how are we going to move forward? So we have to make sure that we keep the tools in place to respond quickly to any future fiscal shocks, including mid-year Board of Public Works actions if necessary. We did that last year. We're going to keep that as a tool in our arsenal. We have faced tremendous adversity, and the state must be wise with our hard-earned money to also help those who are struggling most during these difficult times. I think we've done a decent job of that. And I think we've all tried to rally around to move that forward. But at the same time, my mission, as I've always told the members of the legislature since this whole thing started, is I can deal with the short-term knowns. I'm trying to make sure that we have resources to deal with the future unknowns. This budget accomplishes those goals. I appreciate your time. I appreciate you for listening and inviting me to be here with you today. But most important, I want to thank you for your advocacy. Thank you for your advocacy for all those people who don't have someone to speak for them, to work for them, to help them out. And again, I try to remind everybody it's a light at the end of the tunnel. It's not a train coming the other way. So I'll take any questions that I can in the time that we have left.
David, thank you for that. Bishop Sutton here. Thank you for what you said last year and this year as well. You bring to us every year the Sermon on the Amount. I have my question.
I don't know about that, but
my question for you, and of course, I don't expect you to speak for the entire state of Maryland, but I'm thinking about our tax system and our way of raising revenues for Maryland. And I'm concerned about a system that could be more equitable so that the brunt of taxation doesn't fall more on some than others. That's a general kind of observation, but can you speak to that and any thoughts about how we might make it fairer for people and communities that have a low tax base but have great needs versus other communities that may have a high tax base, especially property taxes, but not as much financial need?
So Maryland tries to balance all of those different wants and needs and concerns. A lot of people don't know that we already have a disparity grant program. And the disparity grant program provides money to, I think it's 7 counties. And those 7 counties are identified because their tax base and their general taxable base, also from the income tax side, is lower than the state median. And then we provide them extra revenue to help. It doesn't eliminate it, but it tries to bolster some of that. Baltimore City is one of those, Prince George's County, those are the 2 biggest beneficiaries. Dorchester, I think Allegheny. Washington County is in there. Certainly Somerset County is in there. Worcester. I know I'm missing some, but there's 7 jurisdictions. So we do provide that type of a, and we reward those counties that when they have exercised all the tools in their arsenal, arrows in the quiver, I guess is one way to look at it, then they get a higher proportion even then. So that's one context. But we also have to pay attention to the balancing act. The balancing act is this. I've always tried to teach my kids a couple things. There are some laws that are immutable. Annapolis can't change them. Washington can't change them. And those laws are, one is physics. You might have the green light, and my kids got sick and tired of hearing me say this. You have the green light. What does that mean? It means we can go, Daddy. I said, well, yeah, the laws say we can go. but the laws of physics tell us that the truck that runs the red light wins the collision. Another law is gravity. There's a whole industry created with surgeons and everybody else to try to fight gravity, but in the end, gravity always wins. The third law is that money goes and capital goes where it's welcomed. And when you create an environment that's very hostile to it, there comes the point in time where the goose laying the golden egg might pack up and go where it's welcome. And I think right now we're trying to strike the balance so that those people who have done very well can contribute and can continue to contribute here in some type of balanced format. I deal with a lot of wealthy people. I did a lot of estate planning with people, and they're giving back to the communities. But we've also, if you become so hostile to those that do have the capacity that when they die to leave it to the charities, to leave it back home, they might pack up and go to Florida. And in which case, then those counties just love the fact that all these people have moved on. I did a lot of charitable work in Frederick. I was on the development council with the Frederick Hospital. In the Frederick Hospital, we built up a tremendous portfolio of people who had named the hospital in their wills. But then a lot of them also over 20 years moved to Florida. And Frederick Memorial Hospital hosted a dinner for all of them down in Naples to make sure that they kept the locals in their process. So what happened? Massachusetts was the first one to decide to do something else from a tax point of view. And they said, you know what? We don't care if you're living down in Florida, the 181 days like everyone had been opposed to. Where are your charitable intent? Where is your charitable intent? And when they found that people were naming their charities back in Massachusetts, they said, no, your residence is technically in Massachusetts. You're doing the 181 days to be a sham. And so then people started naming Florida charities to prove that. The guy who was the most, I'm trying to remember, I drove by, it was not Ave Maria University or something, but the guy that created Domino's Pizza basically provided 60 or $70 million for the creation of a new university down in Naples to prove residency. And Massachusetts was being very aggressive about it. My point is, Bishop, that yes, I hear what you're saying and that we need to go. Basically, what you're saying is there's a lot of people making a lot of money. We need to tax them more and free up some of the stuff on the lower end. But there's a balance that you strike that you don't want people to be losing their appreciation for where they grew up, where their family is, and perhaps the community that even granted them some of the largesse that they have. And that's what I think that we all try to struggle with. And that only comes a lot of that from my professional workings is when I did a lot of financial planning and estate planning for people, that we saw some of those effects.
I'm hoping I am unmuted now.
No,
Can
you're
you
not
hear me?
muted. I heard you well.
Oh,
And I
good.
see you.
Good. Excellent. Nice to see you, sir.
Mhm.
Thank you. Thank you. Thank you for your knowledge. And, you know, you said there is a light at the end of the tunnel, and we feel optimistic about that.
You should. You should.
Yes, and thank you again, Kathy. And just a very quick follow-up. And David, obviously, you know what's behind my question, because funding is everything.
Mm-hmm.
It's one of our stances in the faith community, because we are faith-driven, and we're driven by the life and ministry of Jesus, especially, and the Old Testament prophets. We feel that it is our role, is what we're called to do, to advocate for those who cannot advocate for themselves, the voice for the voiceless, and those who are the powerless. We know that as state officials have to listen to all voices, and you listen to the business community and those who are wealthier and all of that. We think of our voice as a counterbalance to that, so that you can get to the right policies. It's not being against anyone or even against the wealthy and the powerful, but they already have their voices. The church is the voice for those who are on the downside. I wanted to let you know that was behind my question.
I understand that. That's also why I thanked you for your advocacy, and because you're right. As I said, capital goes where it's welcome. And I have seen an awful lot of, where money buys the voices down here and the wisdom to navigate the shoals. To use it in another way, procurement can be a very confusing aspect when people are trying to navigate, procurement in the state. I've always cautioned people in the government. I say, stand up, you'd look good in orange, an orange jumpsuit, because procurement is where most people have gone to jail when it's come to any type of ethical violations or transgressions along those lines. But I also try to point out to them that those type of restrictions have ensured that the contracts go to the people who navigate those shoals best, and not necessarily who delivers the best product or service. And that's a sad statement, but it's the reality. And because we had to put all those guidelines and checks and balances in place, that's where we are. And we try to do that so that there's transparency and that there's not graft. But there are always ways that people are trying to poke and prod it. And I appreciate your advocacy for those who don't have the voice. And as I say, part of our mission is to try to strike a balance, and that we don't run rampant with it. And the other thing is, again, money's not going to be a challenge this particular year. The federal government is cranking so much out. We're trying to figure out what we're going to deal with it, or how we're going to deal with it. The issue is going to be, how do you handle the hangover when that tap dries up? And then we have to decide, what are we going to pare back? Our mission has been to ensure that those who are seriously impacted or even moderately impacted, that they can buy the time. The science and the technology and the medical community is ahead of the curve, or it's getting there. Our mission was just, let's stop the spread, allow them to be able to handle it, and let the vaccines and all come into play. I think that where you right now, as you're talking about advocacy, can do the most good at this point in time, in the short term, is to help us communicate to those voices in need the necessity for the vaccines. The state, the federal government is paying for the vaccines. They don't have to cough up anything out of pocket. But there is reluctance, particularly among the minority communities, and fear, and it's not unjustified as to what it means for them. But right now, we're pretty soon going to have a lot more vaccines that will be in people's arms. And as I heard in my 11 o'clock call, the issue will be dealing with those who are reluctant to get vaccinated. And we need to ensure that they too are protected along those lines. And that's where you can come in to help at this point in time.
Thank you.
Thank you, sir.